Thank you, Dr. Gordon, for that fantastic talk. Our next speaker is Dr. Stephanie Marton. Dr. Marton earned her MD and completed her pediatrics residency at the Eastern Virginia Medical School. And then she came to Texas, where she did a fellowship in academic general pediatrics at Baylor, and also earned her MPH at the University of Texas at Houston. Dr. Marton has worked with underserved populations both internationally in Swaziland and also here domestically in Virginia and Houston itself. She's currently the Social Medical Director of the Texas Children's Health Plan Center for Women and Children in Greenspoint. So everyone to Dr. Marton.
All right. Well, thank you again for inviting me to come chat with you all for a little bit this evening and share with you a bit about what I do. And coming off a very inspiring talk, I was very excited to hear some of the models that you are doing, and I think that we can all share best practices, and that's what I hope you will take away from the next few minutes. So again, I'm going to tell you a bit about how we integrate behavioral health care and pediatric and actually OB care into our clinics, and we are, it's the Center for Children and Women, and we actually have 2 clinics. This is the one that I work at, which is up in Greenspoint. These clinics are run by the Texas Children's Health Plan, and they were strategically located in areas that we know have an underserved population, as well as a lot of kids that have the Texas Children's Health Plan. So they are only for Medicaid or CHIP children. So there is the one right at the corner of Beltway 8 and 45. The other one is on Bissonnette Street down in Southwest Houston. And so just a little bit of, I think I don't need to emphasize this with this group, but the importance of integrated behavioral health care. So of course, we feel like we're identifying and filling a need, but it also is more cost effective. We know that it reduces stigma to be all provided in the same location, as well as increasing accessibility for our patients. And so I think that's the importance. And so here's where we kind of lie if you think of the continuum of integrating behavioral health and medical care. So we are not quite fully integrated, but we are much more than co-located. And you'll be hearing a lot more about kind of how we do that in the next few minutes. Patients, when they come to us for care, they first come in through the medical department, so either the OB side or the pediatric side. We do their initial intake. Maybe it's their well child check they need, or maybe it's just establishing care with us. And then we immediately identify what behavioral health need they might have and get them to the appropriate provider for them. We also have, just-in-time consults. So of course, a lot of behavioral health care, you don't know that there's a need until the kid has come in, they're doing their checkup, and oh, by the way, they tell you this. Or you do the screening assessments at the various ages, and look at this, they had a really high screener. So we have our behavioral health team is very flexible, and that's a word we've heard earlier this evening, but it's very important. And they will be able to do kind of the just-in-time consult. Sometimes they're able to come and do the whole initial assessment. Other times they may stop in for 10 or 15 minutes, again, kind of going over the care plan and getting them set up with their first meeting with their behavioral health team member. So we are also a medical home. We are the NCQA Level 3 certified, for those of you that are familiar with that certification. And this kind of just is a reminder of all the different components of the medical home. And so again, I think some of the highlights that I like to discuss are, of course, enhanced access, and we'll hear a little bit about that. We definitely have care coordination and integration is important. Continuity of care at our clinics, as well as, of course, safety and quality. We are within the Texas Children's system and are able to utilize a lot of their best practices in our daily work. All right, now we have a very unique funding model, which is really how we are able to accomplish what I feel like is a lot. And we are, as I mentioned, all part of the Texas Children's Health Plan, and so we are really a subsidiary of the bigger entity. So we get the per member per month money from the health plan gets dispersed to us as a clinic, and we then pay to keep the lights on, to pay our therapists, to pay our doctors, all from the per member per month money that comes from the health plan. So if you have a kid with asthma and you get them in for their 4 visits per year, every 3 months, they're stable, they're doing great, we probably are making money over the course of that year on that kid. If we have a kid with asthma who ends up in the ER, 3 times in a row and then comes sees us, 2 times a week for, 12 months, we've probably lost money on that kid. And so we kind of take on that risk. But that enables us, from a behavioral health perspective, to get in kids and see them as frequently as we need to by therapists, by psychologists, or our psychiatrists until we feel like their care is where it needs to be. So, this is just the makeup of the Greenspoint clinic, and actually our Southwest clinic is very similar. So you can see we are 2/3 Latino, and then about 25% African American, and then the rest is really other, which is white, Asian, and then some other. Now, what does the 100 mean, you might ask? Well, we are open 100 hours a week. So those are the hours of the pediatric clinic, and behavioral health is open probably about 70% of those hours. We have not 24-hour a day, but we have 7 days a week of behavioral health coverage, and we have 6 days a week actually of OB coverage. So this means that when I'm seeing well child checks on Sunday morning, because we allow any patient to schedule anything anywhere, and at 10 a.m. on Sunday morning they tell me that they are having this horrible anxiety, I call our behavioral health team member who is in the building who can come over and do that assessment. So it's really great, I think, to be able to provide that care that we need when the patient needs it. And these are just a couple of the other departments that are in our clinic. You can see we have OBGYN, as I mentioned. We also have optometry and speech and nutrition, pharmacy, health education, and dentistry. We also have, what's not included on here is actually lab. And so we're able to do a lot with all of these different services. All right, so just a little bit about who is a part of our behavioral health team. So we have 4 really therapists who are licensed clinical social workers. We have a team of pediatricians and nurse practitioners. We have 1 psychologist, 1 psychiatrist, and 2 social workers. And that is the team that staffs the clinics during those 70+ hours. All right, and then a little bit about kind of how we do it. So the logistics, the day-to-day of what happens. So we really don't have a lot of offices. So we tend to have kind of just big space where we can all interact. And so that is very important to kind of have the different teams collaborate and talk amongst each other. We start our days with team huddles. We have a couple of different shifts since we're open for 16 hours a day. And during those team huddles, we go over complex patients that might be coming in, particularly patients that need to see more than 1 service. So the patient is coming in for both behavioral health and pediatrics, maybe also even seeing psychiatry. They might be seeing nutrition. And so we try and schedule several appointments for that day so they can kind of have their one-stop shop. We also use Volt communication, which is like a little iPhone that works only in the clinic, and so we're able to send messages to our team members. So if my psychologist that I work with, Dr. Chapman, is running late, she can send me a message, say, hey, they're coming to you, they're just a little bit late, and then I know I can go on to my next patient and come back in. When she's finished, she will walk the patient over to me and say, hey, this is what we talked about during our session today. Here's where I think they are. Here's how they're doing with their medication. And so that actually really helps me do my job better because I have just kind of heard her assessment in person, and we're able to really share that professional knowledge in real person, real time. We also, as I mentioned earlier, have the just-in-time consults, which is very important it's really important for when we have kids that we didn't expect that have sort of a behavioral health crisis or emergency, where we feel like getting them services that day right then is super important, and they're able to come over and assess. A lot of these may also be to assess for safety of the child, safety of the family, situations where we might be needing to call CPS and things like that. We're going to certainly get our behavioral health team to assist us and figure out a little more of what's going on. And then also at our clinic, we have RN level care coordinators. And these are individuals that do a lot of different things for us, but in terms of our behavioral health team, we may have kids that have multiple other medical problems that are actually managed by subspecialists in addition to pediatrics. And so they're going to help make sure those patients get to those appointments. They're going to help make sure that the kids, that have been in the ER for whatever it is, maybe it's for suicide attempts, that they get back to see us that very next day. They get messages of our patients that have been in emergency rooms. So they do a lot of the sort of various list managements for our patients, as well as the specific needs of those complex patients. And I'm going to, this is just an example. Oh, I clicked something wrong. Sorry about that.
No problem.
Okay, no. There we go, thank you. This is just an example of, we use the Epic medical record, and so we have what's in the snapshot screen at the very top. We're able to put sort of some key things where we kind of look before we go and see that patient. So in the event that we don't have that one-on-one face-to-face with the other clinician, we're going to put key messages right in that section. These are the vault phones I mentioned. And then this is kind of a high-level overview of just kind of the way our space is set up. So we have our pediatric exam rooms all have this central area where we're able to really talk, and we have 4 different pods, and so that enables everybody to really convene and talk about the patient. We also have 2 kind of private rooms that are like glassed-in rooms within the pods that are completely soundproof, so if it's something really sensitive, we'll go actually chat in that room. All right, and so I think I've mentioned a lot of this, but what are some of the sort of flexibility of our behavioral health team? What exactly does that mean, and what do they do? So I mentioned how we do all of the pediatric screens for our patients. For example, the Edinburgh for depression, or the ASQ for pediatric development. And so if we have a kid or the MCHAT and they score high on the MCHAT, or their ASQ is abnormal, we're going to call behavioral health because we think that kid may have autism and needs a further evaluation. They'll be able to come over and help us make the next steps. The behavioral health team, of course, is doing, in addition to helping us with our day-to-day life, they're going to be doing their own therapy for patients, both individual as well as family as well as group. They will often have, say, a group of 5 or 6 kids that all have depression and bring them in, and we'll do some group sessions together. We also utilize telehealth a little bit, and that is on weekends or sometimes in the evenings. We do have a psychiatrist now at each clinic, but on the nights and weekends, they will sometimes utilize telehealth to the other clinic in order to converse with families that might be in an emergency at the other clinic. Our psychologists and counselors have gone out for some home visits, and then of course the social workers will utilize in many different ways. This is very important, which is we have open access appointments, and I mentioned that earlier, but when patients come to see us, we can immediately get them into behavioral health. We don't have a lot of paperwork we ask them to fill out. Of course, we have all of the legal documents that must be signed, but beyond that, they're going to get that immediate intake right with the behavioral health specialist. And we also, we are very busy, and we know that we're very busy, and so we tend to overbook our schedules to really be at 100% capacity. All right, and I mentioned a bit about what the care coordinators do, so I will continue wanted to just spend the last couple minutes here talking a little bit about some of our access sort of outcomes here. So with the center, we actually see this number is now up to about 10%. This is a couple months old. Of the entire health plan are seen at the center. So children that have behavioral health needs are seen at one of the two centers here. We also are doing some innovation with the psychiatrist and the pediatricians. And we have very standardized protocols that will help the pediatricians start that medication for anxiety, start that medication for whatever else it might be, depression. And then if there are starting to be problems, they can quickly get in to see the psychiatrist. We can go knock on the psychiatrist's door and say, hey, I have this patient, I started them on this medicine, this just happened, can you kind of help me? Because I think one of the big barriers is that a lot of general practitioners are uncomfortable with a lot of the psychiatric medicines. And so by having standardized protocols and having kind of easy access to our psychiatrists, I think that has really helped us improve. And this I think is evidence of that. You can see looking across the health plan, we have, this was in 2016, there, just for ADHD, we had 60% across the entire health plan were seen by the PCP for ADHD, whereas at the center that number is actually 88%. I mentioned telehealth, and one last thing to mention, which is about some of kind of how we measure our quality. So as I mentioned, we are not a fee-for-service clinic, and so we operate on quality. And so we have HEDIS metrics that we try to meet, which is a kind of a national metric. And so in the year 2016, we working together were able to meet several of the metrics around behavioral health care. And so you can see those there. And a little bit on cost effectiveness, our pharmacy is very quick to call us. So if there are any medications that we prescribe that could be done cheaper, they're going to give us a call and say, hey, why don't you try this one? Hey, have you used this one? And so this graph here shows that both for ADHD medications and antipsychotics, we are able to use more of the generics when available. All right, and I think that concludes. Yes, that concludes just kind of a very brief overview of really the day-to-day logistics of how our clinic functions, as well as who are the kinds of patients that can come in and how we can get them seen and coordinate their mental health care. So thank you very much.